I remember actually very vividly, I came to my grandmother's house. My uncle was in the other room watching TV in his wheelchair. And my mother and my grandmother were sitting at the kitchen table and they were crying. And they weren't crying because my uncle had MS. They were crying because they couldn't get a hold of their doctor and they were scared and alone. And I told my mom that I would learn to do it better and that I would learn to make sure that nobody treated another family like our family was treated.
Welcome to the Find Empathy Podcast, a podcast for psychologists and therapists who specialize in health. My name is Dr. Meghan Beier, and I'm a clinical psychologist with training in health psychology, rehabilitation psychology, and neuropsychology. Our goal is to help people living with challenging medical conditions find the mental health providers who understand their diagnosis. Our continuing education, which includes this podcast, is focused on increasing the number of mental health providers who can help. Our first series is focused on multiple sclerosis. In every episode, you will hear the voices of people and families living with MS. People like Tyler Campbell, Ashley Pike, and Warren Tannenbaum.
And I flat out woke up and I could not walk. I could not talk. And I had paralysis down the right side of my body.
People with MS, we feel ashamed. This is something we can't control. We have no grasp on it, and we feel this guilt, this incredible guilt that we can't be ourselves.
There's really no guidebook that's given out for the care spouse. All the things that I had to learn and struggle to find on my own, they should be documented, made available almost as soon as you walk in the door.
After you've heard from the individuals with lived experience, you will then learn about the diagnosis from recognized experts and clinicians. A few examples include
Dr. Mitzi Joy Williams. I'm a board-certified neurologist and a fellowship-trained multiple sclerosis specialist.
Adam Kaplan, neuropsychiatrist trained at Johns Hopkins.
Well, my name is Tracy Tyson Miller. I'm in Jacksonville, Florida, and I handle Social Security disability claims.
Finally, for each topic, you will learn about the latest research and behavioral techniques from nationally and internationally recognized mental health professionals. You will learn strategies and interventions you can use in your very own practice to support the individuals and families living with these challenging medical conditions.
A few years ago, we developed a web-based cognitive behavioral therapy intervention that is freely accessible to healthcare providers, to community health workers, and it's at mymstoolkit.com.
Particularly folks who have mobility issues, getting in and out of bed 5 times a night in order to adhere to the traditional CBTI protocol is a bit of a challenge. And so with this program, we're investigating whether adapting it to meet the mobility needs of people with MS can be accomplished without the frequent getting in and out of bed.
But in this qualitative study, we found that these folks who are living with MS, all of them actually in the study said, I feel suicidal between 2 and 4 p.m. in the afternoon, which is so interesting because that's when people have a drop in melatonin. People feel, generally, all of us tend to feel very fatigued. And I think it's really important to recognize that fatigue in and of itself can really be a risk factor for suicidal thoughts.
This is the Find Empathy Podcast. We are launching with episode 1, What is MS and how is it diagnosed, on January 6th, 2022. Please subscribe now wherever you get your podcasts.